Well, I know personally lately a situation that I've been seeing a lot is when I go to get help from any kind of agency, they'll always say hello, bonjour. And then I get happy and I said, oh, bonjour, vous parlez français? And then they go, oh no, oh no. And I said, oh, well then why are you saying hello, bonjour? So I think that that active offer is going way beyond the hello, bonjour and having that little sign with the bonhomme that says you offer both. So it's being able to serve clients in the language that they want. So you say hello, bonjour, and then if the person says, oh, vous parlez français, or they start answering in French, then hopefully the front line staff should be able to respond in French.
Centre de santé communautaire, bonjour.
Il arrive souvent qu'une agence, une institution, un organisme.
Often, an office or an organization has a certain number of bilingual workers, but sometimes those people will be sick or at lunch, etc. To really have an active offer, an adequate French language service, you really need your human resources strategy and also a plan B, if you like.
Un plan B, si vous voulez, où ce que vous connaissez.
You know which people can serve the Francophone population, and if the regular receptionist is absent that day and someone calls in needing French, we already know that Mrs. X can serve that patient's need as well as the receptionist, because the plan or the strategy was put in place, and we've identified the people who can also serve that population.
Ce plan-là, cette stratégie est en place, et puis nous avons identifié les gens qui peuvent aussi desservir la population.
Quand on glisse la carte santé, ça serait bien là, qu'il y ait une
When we swipe the health card, it would be good if an indication appears on the screen that shows Francophone or Anglophone, or perhaps something like that, so the healthcare professionals who swipe the card realize the maternal language of the client. It shouldn't be difficult to do. They can do it with debit cards. I don't see why this isn't something we could do in the future and introduce it province-wide.
Ça pourrait pas être quelque chose à l'avenir qui soit introduit au niveau provincial.
Je crois qu'on a beaucoup de personnes à enseigner
I think
ici.
we have many people trained here at Boreal College and other Francophone institutions who can teach healthcare services in French. We have the numbers to improve the situation, but we need more. I think if we could inundate the system with as many bilingual people as possible to offer French language services as needed, it would greatly help the population that really needs it.
Va aider à la population qui en ont vraiment besoin. I think it's very important for us to offer what we can to whomever we can. Being Francophone all my life, born and raised, I'm happy that I can provide that. And if managers and operators and people who are in the power of making these decisions are able to hire people that are bilingual to help out as many people as we can in their own language, would only benefit them. It would improve their service to the client. It would improve the outcome of the patient because they're getting the appropriate care, the proper tests. And in the long run, a better healthcare system will save us money and also will make our patients much happier and much healthier in the long run.
So whether it be en français or being culturally also aware of, for instance, Aboriginal needs, etc. Also, there's a big question of risk management. There's a huge difference between saying, j'ai mal au cœur, my heart is aching. It is not the same thing. You open yourself up to risk if you cannot properly understand what the patient is telling you about their symptoms and therefore how the healthcare professional will respond to and what type of plan of care they're going to institute to that person. All in all, I think it's a question of elimination of barriers, whether it be language barriers, cultural barriers, geographical barriers. Offering French language services to your French language population is a need, and it will be utilized by the Francophone population.
So my mom is immigrated to Canada about 25 years ago from Mauritius, and her first language is, well, Creole and French. So I think that now that I'm in medical school, I really realize how important it is to have services in French. Because I know my mom's pretty happy that I'm pursuing this career because she's able to ask me for clarifications on what her doctor told her to follow and on specific, just any basic medical questions. And she's more comfortable doing that in French than in English.
Ben, personnellement, moi, je suis originaire.
I grew up in Thunder Bay, Ontario, and often when I speak French, people say, "What? You come from Thunder Bay and you speak French?" And I say, "Well, yes. My maternal language is French, and I have always spoken French at home. And the Francophone community is very close to my
Et
heart.
puis quand que je peux desservir des clients qui parlent français,
When I can serve clients who speak French, it does something for me, and there is a very positive impact at the level of the family. I can see an impact at the level of culture. It brings us together, and I find that the service is better because we have this emotional and cultural connection through the French language.
Ça nous rapproche de parler français les deux, et puis je trouve que le service est meilleur parce qu'on a cette connexion.
So I would love it if those that can speak French in the health field can identify themselves as Francophone so we can better serve our clients who are perhaps too shy to ask. And if we can do it from the beginning, at the start, if they ask if there is service in French and we can say yes, well, that would be incredible. They will be so much more at ease that they can ask for French language services. The shyness is removed because it is the professional who asks instead of the client. I think that it could make an enormous difference, and I encourage all of the healthcare professionals to identify themselves as Francophones and to be proud of it, because it is not for themselves. It is for the clients that it will make a difference.
C'est pour les clients que ça va faire une différence.
Our purpose is to ensure that Francophones in Northern Ontario have access to a continuum of quality French language healthcare programs and services that meet their needs. Contact us to learn more about the development and delivery of French language healthcare services.
Thank you very much.
Oh, puis bienvenue, Monsieur Canning. Au revoir.
Au revoir, madame.